New research has found nearly 4 in 5 women have experienced problematic periods in the last 5 years, and almost half of those have missed days of work or study. The data comes from the latest Jean Hales National Women's Health Survey of more than 1,200 women aged between 18 and 44. Chief Executive of Jean Hales for Women's Health, Sarah White, joins us now from Melbourne. Sarah, thank you so much for your time.
My pleasure.
4 in 5 is an extraordinary number of women. Take us through what makes a period problematic.
So a problematic period can be a period that is very heavy, or it can be painful, or it can be irregular, or it can be a combination of all three of those things. So we have the risk of leaks, we have the risk of embarrassment, we have that pain obviously, and we can have the need for someone to be going to the bathroom frequently to change their sanitary products.
Do you think there is an element here of women's pain being dismissed in the medical space and the workplace?
Well, our results actually showed that fewer than half of these women who experienced bothersome periods or problematic periods actually went to see their doctor. So we're starting from a point of having not enough education. So young women, when they start having periods, or girls even, start having periods that are really heavy or painful, and they don't know that this is not normal. So I think we actually have to start with that education first and then start to look at the care that they're receiving.
And how do we get that education, that message out to young women and girls?
We have to start with programs in school. The average age of starting your periods in Australia is around about 12 years of age. So we actually have to start in schools, having that very good, clear and simple explanations of what's normal and what's not just how to manage them. But we have to have a much more open discussion in Australia, in the workplace and in homes, in families, amongst friends, amongst family, about periods. It's still a little bit of a taboo to talk about periods, and yet we know from this research that it's having a huge impact on young women aged 18 to 44.
Yeah, absolutely. Can you take us through some of the results from this survey? Because missing work and study because of your period is pretty significant. How much of an impact is this having on those women?
We see around about half of these women have missed days of work or study in the last 5 years. Now that's a very broad finding. I think when you look at individual cases, you will find young girls and young women who are just missing out on career opportunities because they're away from work, they're missing out on study opportunities. It's a really big personal impact, not being able to hang out or socialise with friends, being worried about being able to go out when their period is imminent. So there's a big psychological impact, and there is also, thanks to work done by the University of Western Sydney, showing that there's the cost of this, the economic impact of this, is $14.2 billion to Australia. So that's an incredible impact on productivity.
Absolutely. How does that figure sort of come about?
That's really looking at people being present but not working to their full extent, so presenteeism, and it's about absenteeism. We haven't factored into those the sort of costs that women incur when they're going to see their doctor, for example, when they're using over-the-counter pain medicines. For people who have very heavy periods, they may well be going through a lot of sanitary products, and so there's that cost as well. We need to have a very comprehensive approach to support women and other people who menstruate as well. We need to have a good policy approach to helping with these costs that some people are bearing.
Is it time, do you think, for workplaces to implement leave allowances perhaps for periods and other reproductive health issues?
We're not really big fans of period leave, would you believe, or reproductive leave, because our challenge is no matter how many leave days we put in place, it may not be enough. We also know that there are some women who are not eligible for leave. So, for example, if you're in a casual employment or precarious work, we know that there are some people who really will not want to ask for period or reproductive leave. So, for example, gender diverse people or non-binary people. So it's not about taking the person out of the workplace. We actually have to make the workplace safe and suited for people who are going to have these experiences. So it could be things like flexibility, starting work a little bit later. you know, some places still don't actually have sanitary bins. So making sure we have sanitary bins, uniforms that work for perhaps, you know, people being called out, dark bottom uniforms, leave to or time off from the production line or the classroom to go and use the toilet. There are some very simple things we can put in place before we actually start taking women out of the workplace. We want to fix the workplace first, I think.
Sarah White, thank you so much for your time.
Thank you.